Well, good morning, and you are most welcome as always. Now, it's Monday the 16th of March, and I want to start off today with what is a very important announcement that I believe has the potential to save many, many lives. Now, for a long time, I've been teaching that fever is a natural adaptive response. When people have a fever, the viruses do not replicate as quickly as they normally would. And that's the same for viral infections and bacterial infections. And also, when someone has a fever, the immune system is going to be stimulated by that fever and is going to combat any infection more effectively. And I'm just finishing off putting together a video on this where I put the evidence for this in more detail. So what I'm saying basically, I'm talking about adults here, is that fever is generally a protective mechanism. It's good to have a fever when you're sick. It makes you feel absolutely awful, but it's helping you combat the infection. Now, I've been a bit reluctant to go down this path in the past, but evidence now is starting to accumulate. So the French health minister, who is also a doctor, a neurologist who specialises in neurological conditions. So this is a French official, himself a neurologist. Right, the taking of anti-inflammatory drugs such as ibuprofen and cortisol could be a factor in aggravating the infection. Right, there we have a simple statement. I agree with it 100%. Now, what he's talking about here is anti-inflammatory drugs. Now, there's two types of anti-inflammatory drugs that I'm aware of. There are steroidal anti-inflammatory drugs, and there are non-steroidal anti-inflammatory drugs. So, inflammation is the body's response to injury and infection and insult. And we can reduce inflammation sometimes when we need to, because that's clinically important. And sometimes it's clinically important to do that. And to do that, we can use steroid drugs, which are strong drugs which are similar to a hormone produced by the body. Corticosteroid drugs produced by the adrenal cortex, or same as hormones produced by the adrenal cortex. That doesn't matter. So that the steroid or cortisol type drugs, they're the strong steroid type drugs. And in the UK, certainly they're only available on prescription. But then there's this whole other group of drugs called non-steroidal anti-inflammatory drugs. NASIDs, non-steroidal anti-inflammatory drugs. And they are anti-inflammatory. They're not as anti-inflammatory as quickly as steroids or as profoundly as steroids, but they're still anti-inflammatory. And they're available over the counter. This is the issue. So what we're saying is non-steroidal anti-inflammatory drugs, NASIDs, are probably going to make the infection worse with COVID-19. And every home will have this. If you look in your medicine cabinet at home, I'm sure you've got some. Now, these drugs, what are they? Non-steroidal anti-inflammatory drugs, what are they? Aspirin, ibuprofen, naproxen, diclofenac, and there are a couple of trade names that you get for ibuprofen, sometimes called Brufen in this country. So what you need to do is look at the medicine that you're considering taking, and on the packet it should say if it's a non-steroidal anti-inflammatory drug. And if it's any of these, then it's looking like the French authorities are saying, don't take these drugs. And I agree. Now, I am not your doctor. I cannot tell you what drugs to take and what not to take. But if I had this infection, there is absolutely no way on this earth I would be taking a non-steroidal anti-inflammatory drug to bring the fever down. Absolutely no way at all. Or anyone I was responsible for, I would strongly advocate against. In my own care or looking after family members or whatever, I would strongly advocate against taking any non-steroidal anti-inflammatory drug if someone has a fever caused by COVID-19. Now, this chap here, head of pharmacology at Toulouse Hospital, again, French authority. Just mark these words well. Anti-inflammatory drugs increase the risk of complications when there is a fever or infection. So if you want to get more complications, take non-steroidal anti-inflammatory drugs. If you don't want to get more complications, this advice is do not take non-steroidal anti-inflammatory drugs, or indeed any other anti-inflammatory drugs. Now, some people are on the strong anti-inflammatory drugs called steroids because their doctor has told them to. So, for example, in this country, we commonly give one called prednisolone for asthma, or we sometimes use it for other inflammatory conditions such as polymyalgia and other inflammatory disorders. Now, if you're taking prednisolone, I would not give you any advice whatsoever. Let me make that clear. You must call your doctor to ask for advice on that. But if you are taking that medicine, the data coming out of France here is showing that it could be associated with complications. And certainly the over-the-counter non-steroidal anti-inflammatory drugs, these people are advising against, and I agree with them 100%. Now, the French authorities are saying paracetamol should be taken if you have a fever. Now, I'm not saying I agree with this. Not by any means am I saying I agree with this, because we've just talked about the fact that fever is an adaptive response. So I'm not telling you what drugs to take or what drugs not to take. I'm not your doctor. But when I have a fever, I try not to take paracetamol because I'm an adult. If I've got a fever of 39 degrees centigrade, I'm going to feel absolutely awful. 39.5, even hotter than that. I'm going to feel absolutely awful. But I know that my immune system is working better because I'm at that fever temperature. I know that my body has increased that fever temperature quite deliberately. It's not an evolutionary or pathophysiological mistake. It's common to many animals who also get fevers if they have infections, indicating that it's been around for an awful long period of time, this febrile adaptive response. So what these French doctors are saying, that if you've got a fever, don't take non-steroidals, but you can take paracetamol, which goes by the name of acetaminophen in the States. Sometimes we call it Panadol in England, Tylenol, whatever you want. Tylenol is the common name in the States. It reduces fever, but it's not anti-inflammatory. So look at what medicine you are taking. Now, with paracetamol, of course, it's very toxic if you take too much, so you've got to carefully follow the correct dose. So the French authorities are saying, if you've got a fever, don't take the non-steroidals, but if you've got a fever, consider taking paracetamol. My understanding of the theory is that your immune system works best at febrile temperatures. Therefore, I would avoid taking paracetamol, even though it means you feel pretty bad for a period of time. That's what I do. Again, I have to cover myself in these videos. I would advise you to call your own doctor for advice. But there's no question at all in my mind that the immune system is working better, that the viruses are much more uncomfortable when we are at febrile temperatures. Now, I've got quite a few other things to say today, but that's such an important point. I'm going to put that on now as a separate video, because if people all around the world are taking non-steroidal anti-inflammatory drugs, which are so readily available, evidence is starting to accumulate that that is going to increase the rate of complications. And of course, one of the complications of COVID-19 disease, coronavirus disease 2019, one of the complications is death.